Good afternoon, everybody. How you guys doing today? I wanted to share this little throwback. It's Throwback Thursday, so I wanted to share you this video. This was actually my first and only right now TV appearance from back in our old Somerset Medical Center days. It's with me, our old team orthopedic, Dr. James Paroli, and Dr. Bushek from, it was the family practice. It's now Robert Wood Johnson University Hospital. So hope you guys enjoy it. This is a little bit of a younger me, and it was a fun time shooting this thing. So enjoy it, and I will talk to you all very soon. Have a great day.
Welcome to Somerset Medical Center's Health Talk. I'm Dr. John Buchek, Director of Somerset Medical Center's Family Medicine Residency Program. Baseball and softball season are in full swing. Whether you're a parent of a little leaguer, a young player, or an avid fan of a professional team, everyone wants to see their team win and stay healthy down the stretch. On today's show, we're going to talk about baseball injuries, how to treat them, how to prevent them, and also what players can do to gain a competitive edge. Joining us today are Dr. James Paroli, an orthopedic surgeon who specializes in sports medicine, and he's an orthopedic consultant to the Somerset Patriots minor league baseball team and various high school teams. Also joining us, Ryan McMahon, clinical supervisor of sports performance and athletic training at Somerset Medical Center Sports Performance and Rehabilitation Center. He previously served as the athletic trainer for the Somerset Patriots. Welcome. Thanks for joining us.
Thank you.
We're talking about baseball and softball. Why don't we get right down to it? One of you want to go over for me what are some of the common baseball injuries and what is our approach to the athlete, the injured baseball athlete?
Well, you want me to start, Ryan?
Yeah, sure. Good.
Well, obviously there's, the typical bumps and bruises, but since it's a throwing sport, basically, majority of the injuries we see are related to the shoulder or the elbow. You've heard of rotator cuff problems, you've heard of elbow or tendonitis in the elbow. So I would say that the majority of the people that I see in my office are related to shoulder and elbow problems.
Okay, so if we know where the problem's going to be, let's talk a little bit. How do we prevent that? How do we get people, athletes, parents thinking about that arm, that shoulder? And
well, a lot of these injuries are overuse injuries, and an overuse injury is an injury that is repetitive trauma to one particular part of the body. It's not an injury that's going to cause a tear, but it's going to cause an inflammation, which is going to cause subsequently pain, swelling, discomfort. For Little League athletes, I would say that it's very important that when they get involved in baseball, they should take 6 to 8 weeks prior to the season to get into some sort of condition, and that would include cardiovascular, flexibility, strengthening. I think that it's important that they have proper technique, proper instruction as to throwing, running, etc. Majority of the problems we see are with baseball injuries are related to the elbow and the shoulder.
Try to focus on a lot of preventative things in as far as movement patterns. We do strength and conditioning. That's a focus that we want to, try to target. A lot of times, and with pitchers, the first thing overhead thrown athletes in general is warming up, making sure that they know how to warm up. A lot of kids just go out there, pick up a ball, and go to throw. It's not, conducive to what we want. We try to make sure that they understand that it is a total body from the ground up, that they need to be, turned on from their ankles all the way up through their head. So we focus on that. Also, we look at their posture, make sure the posture is right. We want to make sure that they're set properly. that they can move in the correct manner. If we start changing them anatomically and the way their posture is, in their hips and their shoulders, that's going to automatically put another stress on the body or at their shoulder down into their legs. So we focus on that and then build them up, strengthen, and then move on into the, fine things of teaching them rotator cuff strengthening exercises, hip strengthening exercises, depending on their position.
So we're going to come back to this. So far, having the right technique, learning how to actually do these actions properly, having some strength and conditioning before the season of the sport begins, and then warm up. So those are some of the basics right there for injury prevention.
Mm-hmm.
It's interesting, the old saying, the hip bone's connected to the thigh bone, et cetera. It's what they call a kinetic chain, and it starts when you throw a pitch. It starts with your hips, and then it goes to your abdomen, to your shoulder, then to your elbow, and that's why it's important that every part of that chain is strengthened properly. And if one part is weak, that's the weak link, can subsequently cause problems with the next.
I had a conversation actually with a player the other day, and he was asking me, what do I need to do to, get a little bit stronger? And, I was like, well, what do you think? I was just trying to get his. And he was sitting there saying that, he had to do some bicep curls and some bench press. And I was like, no, you need to focus on your hips and in your core first. And then we can do those bench presses and do those rows. But if you don't have that basic foundation built, you're not going to be able to change, like Dr. Paroli said, with that kinetic chain. If it's not impacting and you're not producing right from the middle, there's going to be something off and something doing a job that it's not supposed to be doing. And that's where you can have an overuse injury if it keeps repeating over and over
also,
again.
Affects your performance. If one part's weak, then you're not going to be performing at maximal,
What about some of the injuries, whether they're maybe less common, that are not about overuse, but whether it's base running injuries, sliding, getting hit with foul balls? Are there some things you can do to be more aware of this? Or?
Well, one of the interesting things is, you watch professional baseball and you see some of these guys sliding head first versus sliding in the normal way. Well, they've shown that you really don't increase your time, or decrease your time, I should say, by sliding head first.
You don't get there faster.
You don't get there faster, correct. So, in my mind, obviously you don't want to get an injury, but I would rather have an ankle injury than a head injury. So I think, one of the things that can be taught is that, what I think should be taught, is probably try to avoid head first sliding. I think that may, predispose to some bigger problems than feet first sliding. Now, obviously, with the advent of the breakaway bases, that's been helpful as far as injury prevention as well, but I think that's pretty important.
It's a lot of teaching the fundamentals of the game. Sliding head first. Out in the field, we see a lot of collisions sometimes. That could be, how do we prevent that? Just making sure you know when to call, who's...
Communication.
Exactly. Also, some other things that we see going along with that head first slide. Concussions. A lot of people say, oh, well, concussions, football, lacrosse. There's high collision sports where, you see a lot of that contact. I mean, the Twins catcher, how long was he out for? Because the guy came down on his head in just the right spot. He impacted it, and he had a concussion. And
Derek Jeter dislocated his shoulder, remember?
Yeah, I mean...
Sliding head first.
One of the injuries that I first saw when I began with the Patriots was Billy Hall. He was a proficient base stealer, leads the league in all-time steals. Wanted to go steal home, came in, slide head first, catcher came down on his head. Had a cervical issue in his neck. So, working to teach those fundamentals, slide feet first, be aware of communication out in the field. Getting hit by a pitch and stuff, there's, proper ways to, know when to back off or how to take it, but sometimes that's just, that happens, and it's just more treatment after that.
Softball players, one of the, which obviously is the majority of the softball players are females, they say 70% of the injuries occur sliding. And one of the big injuries, are contusions, abrasions, because sometimes they don't wear their sliding pants. You don't see that often. You don't see that in, male players because they're wearing pants. So that's another issue, is just the proper equipment, proper, uniform, proper gear. And some people talk about using wrist guards to prevent wrist injuries when they're
for base
sliding.
running.
Exactly.
How about, it's a summer sport. You're going to be outdoors for a typical game, 2 hours, 2.5 hours for warm-ups. So what do you do when you're approaching a day of games or even doubleheaders? Like, how do you get athletes ready for that? Are they going to eat properly? Are they going to drink enough? What do you tell them?
We basically try to, educate them on proper nutrition and techniques. What should you be eating? Not high fatty foods. You want to be having some carbs, fluid, especially in the summer, fluid, proper storing of your fluids, getting ready to go for that. Have a lot of issues sometimes, especially with the older athletes. They get into drinking sodas, coffee, anything that's stimulant. Those are going to dehydrate you, and along with the sugars that are associated with that, it's going to give you that quick burst energy, but you're going to be coming down. A lot of these 5-hour energy drinks that we see now, if they go out, they take this, then they're going out there, they're predisposing themselves for heat illness immediately right off the bat. We try to educate, people on how many glasses of water you should drink prior to the game. What you should be drinking during the game. When should you introduce an electrolyte like gel or drink? So just proper education on that. It's pretty much setting them down and saying, don't eat this, eat this.
If an athlete unfortunately does have an injury, a lot of these are not going to be surgical injuries, right? What's the approach to the injury in general? How do you help them at the field? How do you help them after?
Well, obviously, the diagnosis on the field is important, and the severity of the injuries is important. The majority of these injuries are bumps, strains, sprains. If there's a concussion, a significant injury, then you have to take the appropriate steps to make sure that that patient or that person is taken care of in an appropriate way. But the bottom line is the treatment for any acute injury is the acronym RICE: rest, ice, compression, elevation, and also potentially use of anti-inflammatories like ibuprofen. It's interesting. I see a lot of people who come into the office who've been to the emergency room. They get hurt, and the person is told, well, use ice for the first 24 hours, and then you can move on to something else. It's my feeling that if somebody has an acute injury accompanied by swelling and discomfort, ice is appropriate for as long as that is in effect. And the reason for ice is it decreases swelling, obviously, but it also adds a little Novocaine effect to the area, so it kind of helps with the pain. Use of anti-inflammatories, I think, is a good idea as well, because when you do have an injury, an inflammatory response is initiated, and you want to do things to try to decrease that inflammatory response.
What we focus on is making sure that, again, with the diagnosis, we make a proper assessment. As athletic trainers on the field, we see an injury that occurs. We make sure that it is assessed properly, and then the proper action is, initiated, be it going, okay, refer to an orthopedist, refer to your general physician, refer to an emergency room if it is that serious.
Return to play, don't return to play?
Well, if it's a injury where they have an extreme loss of function, and it's going to be something where we wait that 48 hours and kind of see how they respond. Normally, injuries occur, you lose strength, range of motion right off the bat, accompanied with the swelling, and the body is initiating its healing process. So we look to regain that range of motion first. And if we can't, as athletic trainers, we can't start to get those results that we want, then we're going to refer out, and we know it's a little bit more of a serious issue. Sprains, strains, stuff like that, work that range of motion, and then kind of gauge, okay, where does the strength start to come back in? There's a process, and everybody's different because everybody heals in a different fashion. The body has its set process, but again, depends on a lot of different factors that you have, nutrition being another one of those factors. So we look at that and say, okay, we can gauge range of motion is back in this amount of time, strength is back in this amount of time, and then we start to say if it's a shoulder or an elbow injury, there's got to be a throwing protocol that is automatically, placed into that. So if it's coming directly from us, if it's a mild, impingement, we sit there, get the inflammation down, increase their strength, get the range of motion back, and then we initiate that throwing program where we start off small. If they have any, secondary to that throwing program, they have any increase in their symptoms, we're going to back off again. So it's kind of a process where with them throwing, we have to be real delicate with them because they have to be able to throw. And then if they can't graduate them from a throwing program, there's going to be something else that's going on, and we're going to refer out or we're going to continue treatment.
Well, let's talk about that. Some of these injuries do wind up requiring surgery. Can you talk about a typical example or how you work with a family or an athlete understanding that?
As far as surgical indications, well, like Ryan said, the majority of these injuries are not surgical, but the ones that are typically are involved. Well, let's say, for instance, the shoulder. Very commonly, we see something called a slap lesion or a labral tear, which is analogous to the cartilage in the knee. It's only in the shoulder, and it's a situation where it's very difficult to rehab from that because it's a mechanical problem. It's an actual tear within the shoulder. You hear a lot about rotator cuff surgery and rotator cuff tears. There's really two types of population. The throwing athlete and the older person both have, classically can get rotator cuff tears, but there's a difference with the etiology or the reason why a baseball player or a pitcher gets a rotator cuff tear is because majority of these players, these throwers, have some laxity in their shoulder. In other words, their shoulder is a little bit loose just to get back to that position to throw hard. And when the shoulder becomes lax, the rotator cuff, which are the muscles that control the shoulder, they start to get overtaxed, and then they start to fail, and then you potentially can get a tear. So a rotator cuff tear in a thrower is usually associated with an underlying instability or another problem, as opposed to a rotator cuff tear in an elderly person, which is a result of it's got to do with the anatomy, the vascularity, the tissue, but that's kind of a wear and tear thing. It's not a situation that it's not analogous to the baseball player. As far as the elbow, in little leaguers, there's something called little league elbow, which is an inflammation involved in the inner aspect of the elbow. Sometimes you can have and sometimes you can have an injury where the muscle tendon unit pulls off a piece of bone, and the bone displaces or gets caught inside the joint. That would be a surgical indication. It's very rare for a young person to need surgery. Then we go on to the the classic Tommy John injury, which is
What's that more like high school, college athlete?
Yeah, high school, college, and I think in today's world is because we're so much more aware of it. I think, and with the diagnostic things we have, like MR arthrograms, they're a lot more diagnosed and treated very aggressively and very successfully. So, and what that is an injury to the elbow, the medial, what we call the ulnar collateral ligament of the elbow.
You alluded to some criteria for letting somebody return to play if they have a soft tissue injury. When somebody has surgery, what are they looking at? Did they lose a year? Did they lose a season? Did they?
Well, typically, let's talk about a labral tear or a slap lesion in the shoulder. More than likely, you're looking at about 9 months before you're back, as opposed to a Tommy John surgery, which is the elbow, usually about a year. I just saw yesterday that one of the players from the Yankees just got diagnosed with a slap lesion or a labral tear in his shoulder. He'll be out for the year.
So, I mean, if
because the reason being you have to have this, you can't speed up biology. It's got to heal.
Right. If you're dealing with an 11th grader and they find out they can't play baseball for a year, that must be pretty rough.
Yes, very traumatic. As a matter of fact, I just had a young guy that was a high-level baseball player who, unfortunately, needed Tommy John surgery, and he's on the verge of getting college offers, and yeah, of course but it's reality, and you have to do what you have to do.
So let's review about some prevention again. We want to be warmed up. We want to have the right amount of hydration and nutrition for the day. We want to have a strong body, one that has core strength. We want to have a skill set. You don't want to do the same improper motion over and over. So what are some of the resources that families who think, I enjoy watching my kid play, I want to set them up for success, what are some of the resources where they could put this package together?
they can go and work with. We work with athletes at our center at the ballpark, and for athletes that want to do sport-specific stuff and be educated on these preventative exercises and as far as the science, we don't get too much into the mechanical side of it. That's what pitching coaches, hitting coaches are for, but we get them set so they can succeed out there. Dr. Paroli mentioned the instability in your shoulder. Teaching them a proper, I see it with college athletes and high school athletes. They come in and, I'll be at games and they'll be doing their band work that they say is their band work. It's a Throwers 10 program or a Joe's program. And you see them, and they're not doing it necessarily the proper way. Mm-hmm. We want to educate them on how to initiate those, muscles. What do you want to be doing? A lot of it comes from your scapula, making sure you can stabilize your scapula. And a lot of times people don't understand what that means and the muscles that you have to contract. So taking them through that real slowly and understanding, hey, this is what you need to be doing. This is how you need to contract your muscles so your scapula stays down and what that's doing to your shoulder. Making sure that they're doing the exercises in the correct fat in the correct mechanical form. If they're doing it, that it's not going to benefit them. And then...
No, I was going to get, and another issue which we didn't bring up but is very important is the number of pitches that people throw, and there's some criteria that basically say that I think from 8 to 10 you should not be throwing more than 75 pitches a week. From 11 to 12 it should be like 100, and from 13 to 14 should be 125, and you have to have a rest in between. The other thing is the type of pitches you're throwing. It's been shown that a curveball, slider, a sinker, or a screwball puts a significant amount of stress on the elbow, especially on the medial aspect. So we'd like to limit the age in which kids throw those pitches. And the recommendation, fastball, you're going to throw it anyway. I mean, fastball and a changeup are not that much stress. But curveball at age 14, they're talking about screwball, slider, splitter, not till about 18 years old.
Pitch counts and inning limits for leagues and stuff, that's serious business. That's
I think it's more pitch counts than inning limits. I mean, if you can, if you can say I'm going to throw.
Yeah, because a little league inning could be 50 pitches.
Yeah, they could be done.
So you really want to limit pitch counts. That's really what's important.
And they're serious. They're there because you want your kid to play for 8 years, not 2.
Exactly.
Okay.
Exactly. And the whole idea of playing in 15 different leagues and not telling the different coaches that I've thrown this, that's not a good thing because you're only fooling yourself.
Mm-hmm. Now there's been attention more in other sports, but we should mention it about concussions. You mentioned that concussions do occur in the baseball field, and I've seen some where athletes bang into each other. I've seen some where hit by pitch. So just talk a little bit about a parent or an athlete's awareness of concussion and what they should expect when somebody is evaluating the athlete.
The biggest thing is just an educational piece. That is what is really strong right now, is to make sure that we're educated. On the field, people might think baseball. Again, going back to that, it's not a major contact sport. Concussions maybe happen. Look at a catcher. How many foul? You go to watch a professional game or a college game. Maybe 4 or 5 good, solid foul tips that hit them in the face and rip their mask off. Every year, I think I had a concussion with a catcher. There's new advancements in going back to the equipment, the face mask that they wear. I've been an advocate of the hockey-style face mask. I think it deflects more. So being aware of these different things preventatively. If an injury occurs, if you're suspecting a head injury, it's pretty much understanding and knowing the signs and symptoms. It's not just the dazed look. It's the unable to comprehend. Sensitivity to light, ringing in the ears. Not knowing what happened before or after the incident. And this is not just within a 10-minute span. This is maybe up to 24 to 48 hours that these symptoms can hide and then start to show themselves. So a lot of times we think, ding, my bell rung. What if a guy's going in a second, sliding head first? Catcher goes and throws to try to get him out. second baseman or shortstop totally misses the ball, hits the guy in the head. Oh, yeah, okay, kind of just, rung my bell a little bit. That little ring the bell is a warning sign that down the road you have to watch for those symptoms. Are they feeling nausea? Are they having any kind of sensitivity changes, strength losses in there? As certified professionals on the field, we can assess that and make the right call. Okay, you need to go to a hospital. You need to follow up. This is what you need to do. With a parent, it's just knowing those immediate signs and getting through and understanding, and then they know where to move from that point.
And I would just emphasize for the athletes that don't try to do anything to cover what you feel. If your parents or your coaches say to you, do you feel completely normal? If you don't feel completely normal, tell them. You may miss a game and you may be sad about it, but if you go out and get some other injury because you had a concussion and you can't focus, you could lose a lot more than that game that you're hoping to be in. And that's more common a concern in football, but certainly in baseball too.
Yeah, you have to really understand that a concussion is an injury to the brain. And there's, when I was early in my training, the definition was pretty much based on the fact you lost consciousness. We know that's not the case anymore. We know that just an injury sustained, a head injury sustained where you may have headaches, you may feel a little dizzy, you may be loss of focus, that's considered a concussion. Now, there's different degrees of it. There's a grade 1, grade 2, grade 3. And the beauty, I think the nice thing about today, or the great thing about medicine today, is we've gotten to a point where we have criteria as far as when they can return to play. It's no longer, suck it up, get out there and play. This is something that it's a situation that can compound itself and cause problems later on if you don't take care of it correctly. You got to let the brain heal is what it comes down to.
Well, we have time for one last quick question. Anybody have an opinion about playing one sport exclusively, playing multiple sports? What age, should an athlete be thinking about what's my sport?
My opinion is, growing up as a kid, I thought it was fun to play multiple sports up until about high school, and then some of the sports kind of went away. I focused on soccer and ran track in high school, but I was playing club teams all year round. Nowadays, it's really prevalent that they're going 365 days a year, and it's all we're talking about overuse. And if they're throwing 3/4 of that time, that's a lot of stress on their body. I also think it opens up their themselves to different ways of thinking. It's thinking under stress. Certain sports you're taxing your body physically, and you have to also work mentally. So I think there's added benefits in playing multiple sports. But again, if you're being serious about it, there should be a transition point. If you're being serious going about to college, then you should transition into it and solely focus on that.
Yeah, I think that one of the things that I think you're kind of bringing up here, which is a good point, is that a lot of times these kids that are playing, specifically or exclusively one sport, are under so much pressure to perform and to get to that next level that they don't talk about their injuries. They try to play through their hurts, and that's the worst thing you can do. That's the worst thing. I think the only study I've ever seen that really has any merit is that most people say that to play one sport exclusively prior to puberty is not a great idea, because the studies show that the ones that do not do that, they're more consistent in their sport, they have less injuries, and they play sport longer. In other words, the ones that don't play exclusively prior to 10 years old, the ones that play after puberty, right?
Gentlemen, I want to thank you both. Covered a lot of information about injury prevention, injury treatment, and we focused on baseball and softball. Thank you both for your information and sharing with our patients today.
Thank you.
This concludes today's episode of Somerset Medical Center's Health Talk.